From the very beginning of our government's mandate, improving healthcare at every level has been the top of our list of priorities, and with delays affecting the whole system, the urgency of the challenge can't be overstated. Wait times for life-saving surgeries, routine care, and mental health treatment are far too long. Alberta's health system isn't working the way it should and the way Albertans deserve, and fixing it is critically important to improving Albertans' quality of life. And improvements must begin with Alberta Health Services, the largest provincially integrated health system in the country. Starting today, we're creating an integrated provincial healthcare delivery system that concentrates on 4 priority areas: primary care, acute care, continuing care, and mental health and addiction. We believe that by creating specialized organizations within one provincial system, we will enable each organization to look after one area of healthcare only and avoid the scattered and uncoordinated approach of the more rigid, centralized structure that exists now. These changes will apply province-wide to avoid the regional fragmentation that existed prior to the current system. This focus will help the new organizations better manage performance and promote expertise in areas, be faster and more responsive to issues, recognize innovative solutions, and make space for local decision-making and advice.
It is going to show that we are looking to change, because obviously continuing doing what we're doing is not working. We need to bring in change. And we are very focused on making sure that all of these 4 organizations that we set up are laser focused on improvements, on patient care, on making sure that those that are in the front lines are able to provide their feedback to us directly and that we're able to implement it. So again, it's really about, tomorrow will it change? It's taken a long time to get to where we are. It's going to take some time to shift. But that being said, once we get into the new focused areas, my anticipation is that we will actually see better outcomes, because they will be laser focused on making sure that they address the concerns and the problems that they're seeing on the ground.
We, the Alberta Professional Firefighters and Paramedic Association, are hopeful that these changes will bring about much-needed improvements in the working conditions and the overall health and well-being of all pre-hospital care practitioners.
The Alberta Continuing Care Association applauds the recent healthcare reforms by the Alberta government and in its commitment to advancing healthcare services for our beloved seniors. These reforms align with our mission of creating a sustainable and innovative continuing care sector.
What I look at AHS, what I think it should be is Alberta Hospital Services. That's what people should be thinking of, are they delivering the very best hospital acute care services? And are they creeping into other areas that really should be overseen by other entities? That's what this is all about, is figuring out how we can get mental health in the proper structure for decision-making, primary care proper structure, as well as continuing care for the proper structure. That's one part. The other part is that AHS became all things. It is a policy-making body. It is the recipient of the lion's share of funding. It is a service provider. It contracts out to its competitors, and then it evaluates its performance. And those functions need to be separated. The policy-making function is an Alberta health function. The decision on how to fund is an Alberta health function. And so what this does is it puts Alberta Health Services as a service provider and doesn't put them in that conflict position where they're deciding whether to keep services from themselves or contract them out to Covenant Health, or contract them out to a doctor-run surgical center. So that's, I think, going to be the fundamental change, is that Alberta Health Services is going to be focused on delivering the very best hospital care, and then we're going to be able to build out the better functionality in those other areas.